All right, great question about how do I find a person with the right designation or the right background and things like that. Well, first and foremost, it doesn't matter what initials they have behind their name. If they're not functional medicine minded and if they're not mind-body, holistically minded, it doesn't really matter if they're an MD, DO, DC, ND, TCM, doesn't matter what they are. What I would do if I was going to interview a doctor or a practitioner of any sort to work with, I would be asking them, what is your method for determining the root cause of my issue? You mentioned oncology. What is the cause of my cancer? How do we stop it from ever coming back? What caused it in the first place? Things like that. If they can't answer that, which none of them can, unless you find a unicorn out there, please send me their name and number. I would like to call them and congratulate them because that would be amazing. So interview them and say, how are you going to approach my condition? How are you going to approach me versus my condition? Don't treat me like a condition, treat me like a human being, okay? So I need to understand what's my stress, what are my toxins, what are my foods, what are my emotions dealing with, what are my allergies to foods and stuff like that, what are the toxins that are trapped in my body, and do I have any injuries anywhere complicating my situation, and do I have any microbial imbalances that are contributing? I've heard plenty of times people say that cancer oncology is related to mold and fungus. Like everywhere they do a biopsy, there's always mold and fungus located in a tumor. Well, it's because your body's trying to heal something, okay? So rather than thinking, okay, I got to find someone who has a certain degree. You only found one person out of 3 oncologists that are integrative oncologists that offered you actually supplementation. There are protocols out there, whether you're doing non-chemo or chemo, whether you're doing pre-cancer, post-cancer, pre-cancer, during cancer, post-cancer, stuff like that, that you could find. But you want to work with someone that takes you by the hand and leads you down the path, teaches you what you need to know so you can grow and heal permanently rather than having to repeat this over and over again, okay? We recommend you look at the resource link above that Anissa put together because that's going to give you some guides to tools in your area. Without a doubt, I am definitely biased to think you need PEMF because if you have tissues that are considered tumorous, you have low oxygen, low nutrients, and high acid in those areas. By putting PEMF in there, you're going to get high oxygen, high nutrients, and decrease of acid because you get the lymphatics flowing and getting them out of there, depending on whether it's your colon, your liver, your breast, your cervix, your uterus, your lungs, whatever it is. Okay, it doesn't matter which tissue. PEMF is a universal elixir, helps you heal. So rather than diving into specifics, find a qualified practitioner, spend less time worrying about their designation and their degree, and what have they done for people in the past with my condition. Okay, I'm asking them, who have you helped in the past? What did you do? What's the process? And how can you assure me that this is going to help me over the long term? These are things I would ask as a consumer if I was going to seek the help of someone else. So take those with some consideration and then go out and start asking some people some questions. Figure out what you want to know. Okay, how can you help yourself? Ask yourself that. What do you want to know? And if you say, I don't know what I don't know, then go in there and say, hey, I don't know what I don't know, but I need to know that you're going to treat me as a human and not as a condition. Don't manage my condition. Help me be healthier as a human being and happier, and I'll resolve my condition. Okay, so good luck.